One of the biggest barriers to care is when there's a breakdown in communication. But when you have a shared experience, you are able to be an advocate, be there with them and for them. The simplest definition of a doula is that we are coaches, helping our moms find and navigate resources so that they can have the kind of birth that makes sense for them and their families. A Black mother is anywhere from 2 to 6 times less likely to see that baby's first birthday. There are birthing people who are not being heard, and it leads to tragedies or emergency situations. So it is critical to have this social support that leads to much, much better outcomes.
I knew that I wanted to have a home water birth. Some statistics show that I guess someone my age, it's best to get induced, it's best to have a C-section. There was no signs of distress that me or the baby was giving for them to try to push for me to even think about a C-section, except for the fact that, hey, you're 41 and you have gestational diabetes. I was trying to stay as healthy and positive as possible during the birth. Kairos gladly accepted to be my doula, and it was like a weight lifted off of my shoulders. I went into labor on a Friday. I thought my water broke. I was like, okay, I'm definitely possibly in labor. I let Kairos know, and she was like, okay, well, I'll meet you up there shortly. They checked me in that morning. Around about 8 p.m. that night is when the doctor said, it's been so long, and I'm going to give it a couple of more hours. If this baby's not here by midnight, we're going to do a C-section. That really threw my spirit.
I was able to reassure her again and again that she had been completely compliant with her care, that she and her baby were just fine.
Kairos was like, we're going to do this. We're going to make sure that this baby comes on her own. You need to listen to your body. That was a big help to make sure that I could have the natural birth that I wanted. It was like 15 minutes before this deadline they gave me. The doctor wasn't in the room. The nurse was rushing to the door to get the doctor. She's like, doctor, the baby's coming, the baby's here. And Kairos told the nurse, it's too late. We don't have time to wait on the doctor. This is the baby's head. Kairos ended up catching our set as she came out. I really believe had Kairos not been there, I would have been pressured into having a C-section. Kairos made a huge impact to ensure that my birth plan went as close to planned as possible.
I love you. Yes, ma'am.
Systemic racism is still embedded in our medical care practices. As a Black woman, your risk of poor birth outcome does not change with income. The Blue Shield of California program has a unique aspect of sending resources into a community to be able to provide care for itself. That is a setup for success when you can relate to someone who is providing care to you. As a birth worker, it is a dream come true that someone recognizes the value of the work that needs to be done, that is being done, and that there's a closing of the gap between the resources and the need.